Hi there, everyone. Welcome. Welcome to our launch for our final report for Black-Focused Social Prescribing. Okay, well, welcome everyone who's joined us today. My name is Natasha Bonet. I'm the lead for social prescribing at the Alliance for Healthier Communities. And I'm going to start with some housekeeping and some general information about Black-Focused Social Prescribing. And then we're going to turn to a really exciting panel that we've gathered here today. And our panel brings expertise from many different lenses, from being frontline staff, being a navigator, being a director of health promotion, being evaluators, different perspectives of evaluators, and all of them were really involved with the work. So I'm really excited to hear what they have to say. So I'm going to make sure that we leave a lot of time for that. In case you're unfamiliar with the Alliance for Healthier Communities, we are a member organization for community-governed, comprehensive primary healthcare organizations across Ontario. So that includes community health centers, nurse practitioner-led clinics, Indigenous primary healthcare organizations, and community family health teams. And these organizations share a commitment to advancing health equity through the delivery of comprehensive primary health care. So health equity is a big part of what we do. I'm going to start this meeting in a good way with a land acknowledgement. So we recognize that the work of the Alliance for Healthier Communities and Alliance members takes place across what is now called Ontario, on traditional territories of the Indigenous people who have lived here since time immemorial and have deep connections to these lands. We further acknowledge that Ontario is covered by 46 treaties, agreements, and land purchases, as well as unceded territories. We are grateful for the opportunity to live, meet, and work on this territory. Ontario continues to be home to vibrant, diverse Indigenous communities who have distinct and specific histories and needs, as well as constitutionally protected and treaty rights. We honor this diversity and respect the knowledge, leadership, and governance frameworks within Indigenous communities. In recognition of this, we commit to building allyship relationships with First Nations, Inuit, and Métis peoples in order to enhance our knowledge and appreciation of the many histories and voices within Ontario. We also commit to sharing and upholding responsibilities to all who now live on these lands, the land itself, and the resources that make our lives possible. And though I am not a person of African descent, I'm committed to continually acting in support of and in solidarity with Black communities seeking freedom and reparative justice in light of the history and ongoing legacy of slavery that continues to impact Black communities in Canada. As part of this commitment, I would also like to acknowledge that not all people came to these lands as migrants and settlers. Specifically, I would like to acknowledge those of us who came here involuntarily, particularly those brought to these lands as a result of the transatlantic slave trade and slavery. In support of the Alliance for Healthier Communities' ongoing efforts to confront anti-Black racism, I pay tribute to those ancestors of African origin and descent. Today, I'm zooming in from Ottawa, where I find myself on the unceded, unsurrendered territory of the Anishinaabe Algonquin Nation, whose presence here reaches back to time immemorial. We recognize the Algonquins as the customary keepers and defenders of the Ottawa River watershed and its tributaries. We honor their long history of welcoming many nations to this beautiful territory and uphold and uplift the voice and values of our host nation. But it's not enough just to say land acknowledgements, so I would encourage everyone to take some action as a result of this land acknowledgement. So that could be economically supporting an Indigenous artisan or a Black-owned business. So I'd encourage you to take that with you as you go about your day. And if you wish, you can introduce yourself in the chat and let us know from which territory you are zooming in from. So just a little bit of housekeeping in case anyone is new to Zoom. You are muted. You can submit questions through the Q&A panel. And this webinar is being recorded. A link to the recording and the slide deck will be shared by email next week. Okay, let us begin. I'm going to give a brief overview of Black-Focused Social Prescribing. So just the origin story. So the pandemic arrived when many chronic challenges that generations of Black Canadians had been living with for a long time came to light or were being emphasized. Through the lens of COVID-19, many people finally understood how Black communities and their collective health had been in a state of crisis. Anti-Black racism and a lack of action to address it intersects with an absence of transparency, poor integration between health and social care, disempowered health service providers, and a lack of race-based health data to inform population health planning, all of which are root causes of poor health outcomes for Black people. The Black Health Committee released its Black Health Strategy. So this is a committee of the Alliance for Healthier Communities in April of 2022. That same year, the Black Health Committee selected 4 community health centers to pilot a culturally affirming type of social prescribing called Black-Focused Social Prescribing. So these 4 centers, Rexdale, Somerset West, Black Creek, and TAIBU, all had Black leadership, Black executive leadership, and a really proven track record of serving their Black communities. For those of you who are new to social prescribing means connecting someone to non-clinical programs and services that support their health and well-being. So it can be food security, economic security, access to transportation, access to childcare, healthy eating, physical activity, arts and culture, and social connection, among other things. And these are the 5 components that we see as essential to social prescribing. The program. So Black-focused social prescribing was guided through Afrocentric principles, including the 7 principles of Kwanzaa. We had 4,000 clients attend cultural programs and community events, and out of these clients, about 1,600 received social prescriptions. The participants, 41% were older adults, 83% identified as female, 55% reported an annual income of less than $20,000, which means people were living in some pretty deep poverty, and 11% faced unstable housing conditions. Impact. 89% of participants reported feeling a stronger sense of belonging to their community after participating in Black-focused social prescribing activities. 90% reported that their trust in service providers had increased as a result of participating in this program. 87% felt their health and well-being had improved. 40% participated in culturally affirming wellness activities, and 30% engaged in mental health services. One of the issues that came up for us is these high rates of food insecurity, something that will probably come as no surprise to people working in this sector. 80% of the participants in Black-focused social prescribing reported food insecurity, and 68% of participants accessed food programs. And almost all of the participants said this was their only source of food. So we have to wonder what is preventing people from accessing food at other sources like food banks. Is it perhaps culturally inappropriate food? Is it that people don't feel respected or welcomed there? So one of the questions that came up from our evaluation. There was also benefits for the providers and organizations that participated. So staff growth and development, organizational cultures improved, services were transformed, and the way services were delivered was transformed, and strengthened community partnerships. So one of our goals with this project was to support Black economic development by supporting Black businesses. So whenever we were looking for a caterer or a restaurant, we were very intentional about supporting Black-owned businesses, and we were able to develop over 40 new partnerships. What are the success factors? What helped with our success? So the Link Navigators came out as really key factors to success. People who knew their communities, knew the community assets, and built trust because they were from the same community as their clients and knew where their clients were coming from. That was one of our key factors for success. Also having Black representation at all levels of the project, and Black-led decision-making. Also, community engagement, something that the CHCs do very well is build trust, engage the community, let the community make the decisions and lead the work. And that was one of our success factors for this project. So before I get to the way forward, well, maybe I'll just mention it quickly. So we would like to see Black-focused social prescribing institutionalized as a long-term healthcare strategy. We'd like to see funding expanded to support these navigators that are such a key element of this work, and continue knowledge sharing on what culturally affirming care looks like, as well as enhancing data collection and impact measurement frameworks. So that's just a brief overview of some of our results from our project, but I'd like to turn it over to, we have a really exciting panel and they have been working on this work and they bring a lot of expertise. So perhaps I'll stop sharing my slides for now, but let me know if you want me to pop them up again. And I will invite Paul. Paul Bailey is the Executive Director of Black Health Alliance, and he'll be moderating our panel today. So I'll invite Paul to introduce himself, and then I will invite our panel to turn your cameras on and step up and join us.
Good afternoon, everybody. I hope everybody is well. My name is Paul. I am the Executive Director of the Black Health Alliance, and I will be moderating this panel focused on Black-focused social prescribing. I'm going to be joined by Joesi, Stephanie, Neil, Shudi, and Kisa, and I'll have them introduce themselves in that order. And also, as you're introducing yourself, perhaps respond to the question, what brings you to this work? Over to you, Joesi.
Hi.
Yeah, just.
Good morning, folks. So I just wanted to introduce myself, Josie Nelson, and I'm Director of Health Promotion and Community Services at Black Creek Community Health Center. And what brings me to the work is just the community that we work in. It's a community that I lived in, a community that I work in the Jane and Finch community, but most importantly, how Black folks in our community oftentimes in health and in the healthcare setting and environments don't get the services they need to achieve that optimal health and in long term the health of the community. So that's really what centers and grounds me in this work.
Thank you, Josie. Stephanie.
My name is Stephanie. I'm the Black-Focused Social Prescription Navigator at Rexdale Community Health Center. And what brings me to this work is similar to Josiane, as I'm from Rexdale as well, and I'm a Black woman as well. What sets me a little bit apart is I also have an autoimmune disease. So being a Black woman and not being listened to, sometimes you feel like your pain is dismissed as well. So it's very important for me to help with that as well in my community.
You, Stephanie. Neil.
Hi, everyone. Great to be here. My name is Neil Price. I'm the Executive Director of Logical Outcomes. We're a nonprofit consultancy based in Toronto, and we were one of the evaluation partners on this project. And so what brings me here is a commitment to working alongside organizations that serve Black communities, particularly helping to engage with communities and learn through evaluation how we can improve our programs and services. And so it was a pleasure to be a part of this project. Thank you.
Thank you, Neil. Shudi.
Hi, everyone. My name is Shudipta. I'm a evaluation and research specialist, and I also work with Neil with Logical Outcomes. I come from a public health background, and so one of the things that really drive my interest and passion is really understanding that intersection between non-biomedical health, really looking at social determinants. And we know that not everybody receives the same type of healthcare. Not everybody has the same sorts of health outcomes. And so it's always great to be part of initiatives and projects that are working to understand that deeper.
Thank you, Shirley and Kisa.
Good day, everybody. It's a pleasure to be here along with these fine people I've spent working the last years with, last couple of years with. It's been indeed a pleasure. I'm hailing you from Transform Practice. I'm a co-founder and a consultant there. We do participatory evaluation, and this is the part that we brought to this evaluation team. We were one of the evaluators alongside with logical outcome, and our role particularly that was distinctive from the main evaluation was that we were at to work with the participation of the program, and so that was interesting. And what makes us and really allow us to do this work and do it in a way we do it is that we like to work along teams when they actually start doing their work differently. And we bring in the trauma-informed approaches to the work and many other approaches. And so it's indeed a pleasure to be here today and share with you.
Appreciate that. I think it's important to bring ourselves and into the work and help folks understand kind of why we're in this, why we've made the choices we've made at a high level. But maybe over to you, to Joesi, to start. Taking a little bit of a step back, but perhaps what is, in more detail, Black-focused social prescribing? What's the need, and how does culturally affirming care, center within that?
Thank you for that. So I think what's most important around Black social prescribing is the real focus on health equity. We know that we have a system that was built and designed for particular groups, dominant groups, that leave out other folks. And unfortunately, in our healthcare system, it's a reality that folks are being left out, and specifically racialized folks. So it was a system that was built for the privileged, for the non-racialized groups. So how then? But we live in a world and in a culture, and being in Toronto, in which we are so diverse, in which the minority becomes the majority oftentimes in a lot of places. And we have a responsibility to provide healthcare services to folks that are safe. And what we hear is a lot of racialized Black folks in general feel unsafe with a lot of the services we have, or where we're going to be referring them, or just feeling unsupported within the current healthcare system. So Black social prescribing is a way to really build that bridge and to connect folks to services that are relevant to what they need. And culturally relevant to their needs, which is what's missing. Because again, the healthcare system that we have is built on one culture's needs. So it is culturally relevant, our healthcare system, but to a specific culture. So how do we shift that? And the ways that we do that are by providing different kinds of programming that look at working with and within the Black community. So there really is that real push around health equity for the Black community. The other for us that makes Black social prescribing work for us at Black Creek is our navigators. It really is centered in representation, which is what Natasha, and you will hear throughout from my other colleagues, is around the importance of representation. So we ensure that our navigator knew the community well and was also representative of the community. So that helped with the trust to which we talked about. So building, starting and implementing a program that community trusts is important. So really listening to what community is saying. We did it across 4 CHCs. We did a lot of it, the process is the same, but the way that we implemented might have been different because we were listening to our local Black communities, which is important. So the diversity even within the project was critical, as well as organizational buy-in. Is a big one that makes the project successful, that would look at, and it's buy-in on every level right across the organization. So we did do a lot of training that really focused on anti-Black racism, that focused on health equity, really, and we developed an internal committee that supported the BFSP project right across with the organization as well. And then again, just really focusing on building trust in community. I'll pass that back over. Thank you.
Thank you, Josie. Maybe just building off the same thread, Stephanie, what made it successful at Rexdale?
What made it successful at Rexdale is just touching on what Josie said, doing culturally affirming programs workshops, doing your research, knowing what affects us, the community, doing a community needs assessment. So some of the programs that we ran at Rexdale, and I also spoke to another navigator. She gave me some of her programs as well, or workshops. Uh, we've done financial literacy courses, community welcoming fairs as the clothing swap and drives that Black Creek has done, as well as community kitchen, where the newcomers, we worked with some newcomers at the shelter, where they were able to let us know what they were missing from back home. So some, let's say a Nigerian group also did, they like to eat their food. So they told us what to get, the ingredients and such, and we made sure it was there for them. They had transportation to and from the shelter, and they were able to cook have a taste of home, cook their home cooked meal. Either they sat and had socialized together, or they took some back to the shelter, as it's hard to cook at the shelter. As a form of exercise, I've been doing soca size, which is good too, because some Black women don't also like going to the gym, so it's another form of exercise to help with their daily movements. We also utilize Black-owned companies and organizations to ensure that we're keeping the connection Black, and again, building that trust as well.
Great. Just one more double click again for Josie and Stephanie. So I'm curious about, we're talking about the successes, but I'm curious about some of the challenges and just how we work through them. Maybe Josie first, then Stephanie.
Sure. And I think the successes are the challenges. I think, and again, just having a program for Black community, it's very hard for folks to say it. Language is comfortable for us. So if I were to say we were having a specific language speaking program, we're comfortable with that. But when we talk about race, it's the discomfort, right? And when we specifically say Black, there's a lot of discomfort around that. So for us, it really is, some of the challenge is just around the language and people's comfortability, even within the Black community, as talking about Black programming on a high level, I think would be one of those challenges. And again, the organizational buy-in. Not everybody's going to buy in within your organization. So how do you work around that? How do you continue to build the work, knowing that not all folks would buy in? So. Okay. And Stephanie, I can pass it to you if there's anything else.
I'll also piggyback on that as well. I had a few excursions where we promoted it at different events happening at the Rexdale Hub, and a few people would come up and I would ask them first, do you identify as Black? And then immediately they'd be like, why? And I'm like, because the program I run is specifically for Black people. And they'll be offended. And they're like, but what if I want to come to the excursion? But I'm like, unfortunately, it's only for Black people. And then I'd have to go into why it's needed and such. So I guess that's the pushback I usually face. And it is hard. Even sometimes I'll be like, I catch myself feeling a little bit uncomfortable too, because you never know what the other person is thinking, what they're going to say to you. But I have to also learn to be comfortable with using the language as well.
Thank you for sharing that. I think that's important. Maybe over to Neil, Shudi, and then Kisa. Just maybe surface a little bit about what the evaluation is telling us about the work, and then maybe getting a little bit into some of the nuts and bolts. So maybe Shudi, you first. Just surface some of the key insights that you think it's important for us to know, and then Neil and Kisa.
Yeah, so the evaluation really wanted to find out two things. It wanted to find out whether if we implement this program, what will the outcomes be on the folks that are using it? And the other thing that we wanted to know is that it doesn't make a difference if we use a culturally affirming approach, if we use prescriptions that are relevant for not just everybody, but specifically designed with the Black community in mind. Some of the major insights that we found is that in order for this program to be successful, really needing trust from that community is key. And really, this is where, it's really a big nod to the Link Navigators at each CHC that kind of did this work to build that relationship with community members. The other really I think important finding to highlight, and Natasha alluded to this as well in the presentation, is that the number one prescription that participants or that community members used were food programs. They also mentioned, a big proportion of them mentioned that it was their only source. And out of all of the folks that use social prescribing, I think almost 70% were food insecure. And so this is really showing us that social prescribing for this community isn't just an accessory, but it's actually meeting really, really basic needs, needs that everybody should have access to. But for whatever reason, for whatever systemic barriers, they're unable to access that. So those were the two kind of key insights on my end. Neil, if you want to add on to that.
Yeah, sure. I think also an important learning was, and again, this sort of circles around the Link Navigators, but to facilitate these prescriptions, you need partners. You need to have people in the community who you can refer folks to, who can plan an event for you or with you. So we learned the importance of the Link Navigator having time and resources to build those connections, to find appropriate partners to actually deliver the prescriptions, because you don't want a situation where you're trying to do Black focus work, but when you go out to a dance program or you're going out to an art class, you don't have folks that look like the folks that you're trying to support. So a lot of time was spent on building those partnerships. And I think for me, one of the really satisfying outcomes is that those will live on beyond this pilot, and will become partnerships that will be supported for the CHCs moving forward. So I think that was really key. Another thing was, and I'm just going to speak about the evaluation approach, we really took a developmental approach to this evaluation. We ourselves as evaluators did a lot of learning and reflection as we went through this project. There was a lot of having to pause and step back and think about, how do we keep this aligned with the principles of Kwanzaa that we were trying to center, and how does that actually impact the evaluation? So one example is the amount of time it took a lot longer to get to consensus and to make decisions at times, because we were focused on ensuring that everyone felt heard, that everyone was weighing in on decisions. And I'm thinking back to trying to work through even deciding on what we wanted to measure together, what was important to the group in terms of outcomes and measures. And so from an evaluator standpoint, doing this work, because it's principles focus, you have to be able to step back, not come with preset notions of how a project like this will be evaluated, and really open yourself up to the learning that's happening among the group. And so that's been a great experience for us as well.
Thank you for that, Kisa. I mean, you focus more on the participants and participatory evaluation. That's the first time I've heard that term, actually, and so I'm fascinated about perhaps the insights that have come through that, and maybe if you could color that image a little bit more for us to understand, what is it like to use that method in a specific way and within this program.
Yeah, I'm sure, of course. So participatory evaluation in a nutshell is basically, so in relation to the program, we know we had a program. It was already running by the time we intersected the program. And so basically the program had outcomes. And so our job in a nutshell was, are the outcomes working? Is the program meeting the outcomes, right? So we look at accessibility rating at that point. And so how do we know if it's working? We talk to the participants, the one who's actually engaging in the program. And so part of that participatory evaluation that we did is, our approach to evaluation in this participatory lens is, how do we bring the ones who are actually the community into the co-design of the process, into into the work, involve them into the work, with an understanding that we're bringing knowledge, but we are also intersecting people with knowledge. And so they can, as how do you navigate those power dynamics, right? Of when you're working in community and inviting them to the table and say, we need you, we want to work alongside you. This couldn't happen and we couldn't be doing it without you. So your participation and the expertise that you bring is very important to us. And so there's a process of engaging participants of that level, especially when I say power dynamics, is because the team in itself has already been meeting. So you have to understand, project is already up and running. And now we bring in participants at a level into the decision-making processes, right? And how do we do that safely? And so how do you invite them into co-designing alongside you? It really isn't a compliment service. You're holding their hands and bringing them alongside you. And I think the project at that point, when we intersected them, really needed that. And so one of the challenges, thank you, Josie, for bringing up the language, right? Understanding that we're meeting and we're using and we're comfortable with the language, we're comfortable with the work, but the participants is experiencing through a completely different lens, right? So it's all that process of how do you bring them to see where you're at? How do we meet them where they're at? And so part of it was that we brought them alongside us. There was a participatory evaluation advisory group. And so they took the lead into designing the approach. So they picked the evaluation tools. We presented to them. They had several tools to choose from. And so they were able to pick the tool. They were able to design the data collection method, how we're going to collect the data using the tools. They were able to facilitate the process as well, help with analysis, help with the design. So it's how do you bring them along into that work? And so that was basically pretty much our role. I hope that picture was painted, that our role was specifically just with the participants and testing to see how those outcomes are. Are we actually meeting the outcomes? Is the program working, right? And so that simply was in a nutshell. But I really like the language, and it's very important. Because when we're intersecting community, we have to understand that community uses a completely different language from that of the funder, right? And the construct of Black. Not many people really identify as Black, and I think in the Black community, that is something we wrestle with. It's a system. It's a system language of categorizing people and putting them in a basket. But when you get out in community and you started to talk with them and engage with them, it's really about a culture, right? It's about how do we relate culturally. And so I can absolutely understand Stephanie and dilemma. Well, it's Black, but I get the culture. I grew up in the culture, like, and so it's those wrestling and those nuances. I think we have to be a bit more culturally relevant when we're doing this, and so listen to what we're hearing from community and making sure that we are supporting community in those decisions and how they want the program to run. I hope that makes sense.
It certainly does, and I think it's a good bridge to what I was thinking as you were speaking, which is I struggle with something sometimes. It's like this. We talk about culturally affirming care, and I think it's like a if you know situation. Like if you've grown up in the culture, so to speak, if you've grown up in the work, if you've trained alongside folks who get how to serve different communities in a culturally affirming way, you kind of just learn it that way. But it's very difficult to talk about sometimes in a clear fashion. What does culturally affirming care mean? And so I want to throw that question out. Maybe you, Josie, and Stephanie, like in context. What does culturally affirming care look like? When one of the things in the report and this piece is the Afrocentric principles, the Nguzazaba, or the principles of Kwanzaa. What do those look like in reality? I know you spoke to it a little bit before, but maybe just shed some more light on that for us, please.
Sure. So really, what as part of this project, it was the key of it, and I hate even calling it a project because these are people's lives, right? So really, because projects start and end, and this shouldn't end. So I'll call it I don't know what the language would be, but Really embedding the Kwanzaa principles right throughout, from the inception, from the initial referral to the navigator, to filling out the intake form, is embedded in terms of asking very specific culturally relevant questions, to the types of programming and the different services that we use. And to give a very specific example, and I can just pull out a few of the principles that we've used. So Ujama, you talked about, Neil, around supporting Black businesses. So one of the key facets of the program is to ensure that we support and look for and source out Black-owned businesses and organizations. That was critical to this. Another is around NIA, is around purpose, ensuring that the activities really reflected the community, and the cultural value of the community and the community that you're serving, because we're not monolithic. Even the cultures could be slightly different, but knowing and who you're working with and knowing the purpose around that. So that was very intentional in the work. Also looking at Moja around community building. That was a big part of it when we look at participatory research, evaluation. Those are all around building community and their capacity. And the project was very collaborative, which is a part of, Umoja, and it was centered around family and kinship. I can tell you, I can say it, and I don't have to go to the meetings, that the navigators became a family in and of themselves, right? In terms of how they supported themselves as Black workers, doing a Black-led project. So right in there is the principle around Umoja, and then really around Kuamba. Oh, sorry. I'm in my lights that go up. Sorry, just yeah, we have that class. We have those lights that just in my office for some reason they just shut up. Just again, so going back to Kuamba around innovative interventions within this project, looking at storytelling, incorporating art and dance and music that was infused throughout, again, and leaving a better legacy. And I think that's part of this project, is we're here today because we started, it's still in its infancy, but there is a legacy that has been left behind about Black social prescribing that we need to continue. So I think, again, the whole program was built on the principles of Kwanzaa, and it's infused right throughout that. And it really is around connecting individuals to services, and really providing that holistic approach.
Got you, Josie. So, Josie, you're mentioning cooperative economics, purpose, creativity, unity. Anything to add there, Stephanie, in terms of like helping to shed a light on what do the Afrocentric principles look like in practice, or the principles of Kwanzaa look like in practice in community?
I feel like Josie said most of it. I don't really have much to add on, but I would say the cultural affirming care is more ensuring that all the cultural, social, emotional needs of Black individuals are always met as well. So I guess going on like celebrating holidays that only also Black people celebrate as well. So we did a Kwanzaa celebration as well. We did it on the second day, which was self-determination. So we gathered together, which is community. We had some African-inspired food. We enjoyed togetherness, and we had African drumming as well there. So from there, we were able to speak about what self-determination means to our community as well. And yeah.
Well, if I can just also, Stephanie, support Stephanie with that, like the marketplace that both Rexdale and Black Creek have done infuses all of the principles of Kwanzaa, really providing that local opportunity for folks to share some of, if they have created a product, or if they just, an opportunity to do a clothing swap, if somebody has more and someone doesn't have, and really building on that sense of community the way that they've identified. And I think that's the core of when we talk about cultural appropriate care, and culturally it affirms their identity, it strengthens community, and it empowers individuals, and just really leads to a better health outcome overall. So I think that's really what we would both summarize, right, Stephanie?
I can appreciate that because you're speaking to it. It's, there's trust that has to get established. There's, you're talking about unity and building the team and building community through some of the processes. You're talking about cooperative economics and, okay, we're going to be intentional about, going to certain businesses to support this work and engaging in that. And then together you're starting to build perhaps a bit of a system, not a program, that is getting at the way that communities are identifying they want to be served. And that to me sounds very, very, very powerful. Maybe I would ask again, you Stephanie, you Josie, and then also if Shudi or Kisa or Neil has anything to add there. But in a truncated fashion, are there stories that stand out to you from the client experience, or things clients might have said to you that might help us understand again, like the impact of the program on on their lives, as you said, Josie. Maybe use first Stephanie and then Josie.
I could share two stories. So I spoke to Renika. She's the navigator at Black Creek Community Health Center. She spoke to me about one client that initially when she came, she felt disconnected from programs as she was attending other programs that weren't culturally affirming and just felt discriminated against. When she started coming to more BFSP programs, workshops, and events, she became more comfortable within herself. Ren said she watched her grow from sitting in a corner at events to now making friends. And she's smiling. She will tell Ren she's going to come to every program Ren runs. So like, it makes you feel like it might be something small for you, like just a little thing, like maybe you smiled at her, someone smiled at her, and now she feels like she has to come to every event because she just feels herself. She sees more people like her, so she's more comfortable. So that happens slowly over time, she said, but like I said, she makes more friends now. She comes to every event, she helps, and it's just nice to see that the work you're doing is impacting people greatly, because they could be a newcomer, they could be going through something that you don't see, but once they attend your event, then it's something special. And then another one I have for myself, in last December we did more of a food hamper groceries for some families. And there was one client that when she came, she doesn't know my face. So she just said, "Oh, can you make sure you tell Stephanie thank you?" And she was the only person that said it. But I'm like, "Oh, I'm Stephanie." And then she just dropped everything. She was so happy. She gave me a big hug, kept thanking me. And I was like, "Oh, okay." Like, wow. Like, okay. Like, it felt good too. Cause I'm like, of course I know what we're doing is good, but the extra gratitude just makes everything better.
Yeah, there's a way that something as simple as a social prescription, you guys are talking about all the work that's going into try and making sure that it's relevant, etc. But simply helping folks' needs is life changing, and I think that's what we're hearing in your stories.
Mm-hmm.
Josie, anything to add there?
Yeah, I don't necessarily have a particular story, but just really, again, for me, the stories that I have is how the system doesn't work, right? In terms of the disconnect. And I think the story that we need to listen to are the stories that Stephanie said today of how it does work when we do programs like this that will change, that will become a system, and that will continue to impact change.
Got you. Maybe back to you, Shudi and Neil. Food security seemed to be the number one thing that was handed out, and I just wonder if you could double click on that for us and kind of just share some of your insights on that from an evaluation perspective.
I can go ahead and then Shudi can say. Yeah, I think this is a really important finding, because one of the questions we kept asking ourselves throughout this project was, how is this different from social prescription generally speaking? How is a Black focus approach to social prescription different? And so when we saw the focus on food, it reminded us that when you're working with Black communities, you're inevitably coming up against health inequities that Josie talked about when we started. And so even if you are trying to arrange, let's say, a dance excursion or a theater experience, you're trying to build social connections for folks who are coming out to these programs. You can't lose sight that these inequities are there and they can show up in these different kinds of events. So I think in answering that question, it means that Black-focused social prescription has to center the issues that come with what it means to be Black in our cities, in our space, the kinds of challenges that we know our communities are facing. And that has to be placed at the center of everything, even if it's recreational, social, art, arts focused, et cetera. You can't lose sight of those inequities. And given that it was food, it was just very stark. It was very clear. It was a very clear finding for us. So I think we were able to answer, partly at least, what Black-focused social prescription has to look like moving forward, what we need to build on. Yeah. Shudi, is anything you want to add?
I think I'll just add on to say that seeing how impactful social prescription was specifically for the food piece also goes to show that you need to start with sometimes even what we might consider basic needs before we can build on, other parts of health outcomes. I think it helps us recenter and think about, Josie spoke about, we've heard stories about what don't work. This is showing us that these are things that will work for the community, that they need to eat, as everybody does, and they need a space where they can feel like the food they're getting is relevant. It's something that they're familiar with. It's not unseasoned, bland, as we all know. So I think those are the pieces that really come out of it. The other thing I would also add is that on top of food being the number one prescription, social gatherings and events were the second most, I guess, attended prescription that was. And the other piece to think about when we look at that finding is that food was at the center of often a lot of these community events and gatherings. And so it's difficult to look at each prescription on its own, and we need to look at how it functions in a broader ecosystem, very similarly to the way we think about health, and we need to think about how our health functions in the broader ecosystem. And so we can offer food, but if we're offering food and we're offering an opportunity to connect with others, to develop more social connections, then you're able to hit more things and meet more needs, and ultimately create a more holistic pathway to health. And so that's, I guess, one of the key learnings that came out of that.
Can I just piggyback on that for a second? I want to go back to your question, Paul, about what is culturally affirming. I think culturally affirming would mean that if I'm a participant that shows up to an event, I don't have to feel stigma around that need around food, because the folks who've organized it have already made a set of decisions about who I am, the lived experience that I have. Why? Because they share it. And that prescription is therefore then designed in a way that I can come in. I don't have to feel stigmatized. I'm not traumatized or re-traumatized. There's going to be the hope is there's going to be the intentionality around who's showing up, and therefore how that needs to be planned and organized and delivered. And that's culturally affirming. Culturally affirming is that intentionality and reducing stigma, reducing a sense of you're not deserving of these supports. So I just wanted to come back to your question, because I think it's a really good one that we have to keep asking ourselves, similar to the question of what makes it Black focused, the social prescription. But I think it's that intentionality and having that experience be one that's easy, inviting, welcoming, and that person can come into that event, that space, feeling whole.
Yeah, when I think about culturally affirming care, I think about client-centered care. Josie talked about understanding, what people are walking in the room with, whether it's that day or their identity, etc. You folks are also talking about, some of the specific ways that some folks may be showing up. That might be sometimes a generational thing. Like I took note of one of the stats in the report around the focus groups and surveys, that 41% of those that participated in those things were ages 60 and plus. And so I, wondered around the social gathering. I wondered around the food support, how do those things kind of play in, gender, age, the sense of like belonging and building community and getting those needs met. And so Kisa, I guess I was curious for you. I think you spoke a little bit about those focus groups and the participatory bits. Maybe shed a little bit more light on some of the impact that you heard in that setting.
Yeah, and when as I'm listening to the conversation about food, food is very important. It's very culturally relevant because it's the breaking of the bread, right? And it's a practice that many Black families, Black community, when they come together, it's food. Food is the center. Food brings people together, right? And so we have to understand the importance of food in building trust and building relationships in this process. I'm always reminded of a big impact is that we had to go to all the CHC and meet the participants and engage with them. But it's Ottawa, Ottawa is I don't know, it's because they just flood, they just came out. It was I would say Ottawa always felt like they were lagging behind in the Black-Focused Social Prescribing program, but oh my goodness, they were the ones that it really shows the impact of the importance of breaking bread, the importance of having a meal, what it does. It brings people together. And it really shows during the pandemic and isolation of immigrants and new community and the health center trying to strengthen engagements with their Black population, just to intersect with them, to see that over a meal, how it is important what food does when it brings. People are excited to come out and connect, right? And so at this particular, and I believe it was one of our data collection sessions, and just hearing the stories of impact, like it moves you to the core, it shakes you, it shows you that this is relevant, this is important, right? Every prescriptions, and I know food prescription was the highest, but there were other prescriptions. To hear a young female, in the Black culture, hair is important. Our hair is very important. It's so relatable. Unless you're part of the culture, you wouldn't get it, how important our hair is. And to hear a story of a young Black girl receiving a prescription for hair care and how beautiful she said she felt after. She's been here. She was never able to connect to a Black hairdresser to get her hair done. But as she's sharing the story, the aunties and the mommies in the room are like reaching out to her and said, here's my number, reach out to us, we will help you. So it's those, when you bring people of cultural relevance together, is the support like that grows out of it, right? That it's a healing process, it's a growing process, it nurtures you on so many different levels. And the impact stories, I mean, and that's just one of them, and we don't have time to go through the list of them, but to hear participants share their stories and how these programs has actually reduced loneliness in their life, connect them back to culture, connect them back to their roots. It's really amazing. So I don't know how much more we can preach and scream and say it is relevant. And we hope that, we get the funding to continue these kinds of programming.
Right. Thank you for that, Kisa. Maybe I was gonna do one last lightning round, but I think maybe if there are any questions from the audience, is it that folks can drop them in the question answer box? So if we get to them, we'll try. Maybe just to anybody that wants to speak to it, what do you think is important in terms of like the next steps, the success factors that y'all spoke to? Like, what's the way forward for some of this work?
I can start. I don't mind. I think for me, again, being in a leadership position at an organization, and hearing and looking and seeing the impact, it really is around long-term sustainable funding, and that's my plug. Enough with projects. It's not a project. These are people's lives. We talk about client-centered approach. It can't be a project. So really looking at long-term sustainable funding, like looking at it like if you tap your health card, you can, see a doctor or something like that. So just where the funding is always there. So that would be my plug.
Thank you, Josie. Anybody else?
I'd like to see the Link Navigator role really, building on Josie's comment, like really supported. We heard a lot about, the success that they had, but also the challenges, the burnout. Like there's a lot of strain on those roles. And so it would be great to really examine that role and see what resources are needed there to support the Link Navigators that are doing that critical connection work. What kind of training might they need? How might their workflows be designed in a way that makes this viable on a sustained basis? So I'd like to see some further work looking very closely at the role of the Link Navigator and how that can be solidified, supported, and strengthened.
Well, on that note, I want to thank all the panelists for their powerful, powerful contributions. Seeing some stuff in the chats, folks thanking you for sharing some of that insight, etc. Maybe back over to you, Natasha, just for a little close and about how we're moving forward.
Sure, sounds good. I will quickly share a couple slides, including the link to the final report. So bear with me. I am slow with technology, but maybe you can see. So these are our key messages for the way forward, as mentioned by our fantastic panelists. And then this is the QR code. So if you'd like to take a look at the report, it's available in English and French. So you can go to that QR code to just grab a copy of the report. And I believe that's all. There it is in French. And then we can always access more information on our website. So alliance.org/social prescribing. We have all the information there. Maybe I'll just keep the QR code up for now. And just join me in thanking our amazing panel. I was very moved by all of what you had to say. And really, these are the folks that are doing the work and making it happen. And so just huge kudos to our amazing panel today. Thank you very much for joining us today.
Thank you.